Capstone and 5-Year Plan by Candice Dousay for Lamar University, Course 4580, Synthesis of Professional Nursing. I have been a nurse for 7 years at Bayshore Medical Center. My experience at Bayshore includes 4 years in pediatrics and 3 in neonatal nursing. I received my associate's degree in nursing from San Jacinto College in 2010 and then proceeded to pursue my Baccalaureate of Science in Nursing at Lamar University with hopes of graduating in December of 2018. I have been married for 13 years and I have a 2-year-old daughter. In my spare time, I like to travel with my family. Student Learning Outcome Number 1, Humanity and Society Construct. Practices safe and effective holistic patient-centered care to a variety of patients and or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I felt that I reached this outcome through the course 4316, Activity 1, Healthy People 2020, with my paper, Breastfeeding Goals, in which I discussed the benefits of breastfeeding, reducing the amounts of babies receiving formula, initiating breastfeeding immediately after birth, and obstacles that nurses face. I also felt that this was accomplished through the course 4550 with the Global Health PowerPoint on International Nurses Society Addiction, in which I discussed preventions and treatments of addictions. I felt that this outcome was met at 97%. Student Learning Outcome Number 2, Lifespan Health Continuum Construct. Supports patients and or clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I felt that this was accomplished through the course 4620, Practicum Reflections 1, 2, and 3 on bulimia nervosa, in which I interviewed somebody with the disease, created a plan of care, and evaluated my plan of care. I also felt that it was accomplished with the course 4216 with the digital clinical experience of Brian Foster, in which I discussed the importance of completing a health history and assessment for a patient and or client with chest pain. Student Learning Outcome Number 3, Lifespan Health Continuum Construct. Evaluates patient-centered care for patients and or clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. I felt that this was accomplished with the course 4316, Discussion Board 4 with the Miss Park scenario, in which I discussed interventions and educational programs for residents in the facility. I also felt that it was accomplished through the course 4620 with the community-based service learning practicum activity, in which I discussed lung cancer and community resources available for somebody with that disease. I felt that this outcome was met at 95%. Student Learning Outcome Number 4, Evidence-Based Practice and Clinical Reasoning Construct. Synthesizes clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. I felt that this was accomplished with the course 4321 with the DEC formal APA paper on nursing competencies. I also felt that it was reached with the course 4390, exercise 2, quantitative research assignment, and with the same course, exercise 3, quantitative research article critique. Student Learning Outcome Number 5, Patient and or Client-Centered Care. Employees safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and or clients and members of the interprofessional and intra-professional healthcare team. I felt that this was accomplished through the course 4550 with my effective leadership paper, in which I discussed the qualities of a leader. I felt that it was also accomplished with the course 4321 with my philosophy paper on nursing and caring. in which I discussed what it means to me to be a nurse. I felt that this outcome was met at 92%. Student learning outcome number 6, professional roles construct. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and or clients as a member of the interprofessional and intra-professional healthcare team. I felt that this was accomplished with the course 4580, with the Lewis Blackman discussion board. I also felt that it was accomplished with the course 4550, with the clinical application assignment, in which I discussed organizing and managing a practice guideline or a procedure revision. I feel that this outcome was met at 95%. Student learning outcome number 7, professional roles construct. Demonstrates professional integrity, effective communication, active inquiry, and service to the community. I felt that this outcome was reached through the course 4540 with the Practicum Project Form 1 and Windshield Survey. I felt that this assignment helped me assess a particular area to better aid my patients. I also felt that it was accomplished through the course 4540 with the Community Practicum Project Planning Sheet, that helped me determine how a disaster would impact the daily lives and healthcare needs of the community aggregate in case of a disaster such as a hurricane. I also felt that it was accomplished with the Practicum Project Teaching Plan 4 with the video, demonstration, and pamphlet that we did to educate our patients on what to do in that type of scenario. I felt that the outcome was met at 98%. My 5-year plan. My 5-year plan, hopefully, will be from 2019 to 2020. I hope to transition to NICU nursing. I am currently on a wait list for that. After transitioning, I hope to, in 2021, obtain my RNC in neonatal intensive care nursing. After that, I plan in 2022, hopefully, to obtain my master's degree in nursing education. And then, hopefully after that, after my 5-year plan, maybe in the future become a college professor.